I'll write until you say we're live.
We're live.
Hi everybody, welcome to our February Facebook Live session here at the Foundation Fighting Blindness in Canada. My name is Dr. Mary Sunderland and I am the Director of Research and Education here at the Foundation Fighting Blindness. So, as a start, I have to tell you that we were almost going to cancel today's session because we're looking forward to talking about the patient registry, and we just had a big story about the patient registry on our website. And the story and some of your questions and comments brought to light the fact that we're actually having some technical difficulties with our website. So we were trying to fix the technical difficulties and we were gonna have a notice about what's happening, but I thought, you know what? This is what Facebook Live is for. Let's just talk it out. So if you are watching right now, please say hi in the comments so that I know that you can hear me, and please do send in your questions. But today I'm just going to focus a little bit on the patient registry to try and answer some of the key questions that have been coming in since we had the story in our e-news, and that's really what I'm going to keep the focus to today. And we have a little something up our sleeves for later in the month, because February actually has two kind of vision health awareness moments happening. It seems like, well, it is true. Every single day is a special day, right? Like you can get it. Does anybody know what today is? I don't know. It's probably like, who knows?
Bubblegum Day.
International Bubblegum Day. Let's go with that. But we know that February is Age-Related Macular Degeneration Awareness Month, AMD Awareness Month, and it's also Low Vision Awareness Month. So in recognition of those two very important sort of eye health, vision health awareness months, we have something that will be coming up later this month, so stay tuned. But today, I just really wanted to take this opportunity to share a few key points about the Foundation Fighting Blindness Patient Registry and answer some of the questions that came in about it. So first, I'll answer some comments that came in from people that said, hey, I filled out this form twice and I haven't heard anything. What happened? And so to people that sent in those comments, thank you, because this is what made us realize that we're actually having some technical difficulties, and we have been having these difficulties since what looks to be February 1st, 2018. So if you came onto the Foundation Fighting Blindness website, that's ffb.ca, and I think the patient registry page is ffb.ca/patient registry, am I right? Yeah. There's an automated form that you can fill out there that kind of initiates the process between us and you and sharing information. And we've realized that that form, that automated process, has not been working properly, again, since February 1st, 2018. So just today, we went in, we became aware of the problem, and we've updated the website with a little sort of announcement at the top that says, you know, this site's under construction, we're experiencing technical difficulties. In the meantime, please send us an email at info, I-N-F-O, @ffb.ca if you would like to learn more about how you should proceed with the enrollment process. And so that's been updated on our website. And again, if you think you filled out the form and you didn't receive a confirmation, then send us an email. We hope to have this sorted out soon, and we'll let you know as soon as we have it sorted out. So to those people who send in comments, I hope that answers your question. Thank you for helping us realize we're having a problem. So now I'm going to answer sort of a few general questions that have come in from many different people about the patient registry since we posted an everything you need to know guide about the registry on our website. Well, I should also let you know that we have kind of everything you need to know guides about a few different sort of key topics that we get a lot of questions, and we know there's a lot of interest from our Foundation Fighting Blindness community. So even if you're interested in more of these sort of everything you need to know documents, you can just search that through the search bar at the top of our page and find more of them. So we updated the patient registry one because we get lots of questions about the registry, and it's even though it's kind of basic, it's kind of tricky to understand. So let me do my best to let you know this is what you need to know. So I think it's pretty cool that the Foundation Fighting Blindness Patient Registry was started kind of long before we really needed one. It was a very forward-thinking, innovative project that was developed with a vision for the future. So it was started in 2004 with a really generous grant from CIBC, Canadian Bank, that provided funding to the Hospital for Sick Children here in Toronto, which gets known as Sick Kids Hospital. And it was started by a wonderful ophthalmologist and a longtime friend of the foundation, Dr. Elise Ayon. And she conceived of the registry thinking, you know what, we're doing all of this research, we want to develop new treatments for patients who are living with retinal dystrophies. So retinal dystrophies, now sort of over the past few years, these get referred to as inherited retinal diseases, or IRDs. These are diseases like retinitis pigmentosa, Stargardt disease, Leber congenital amaurosis, Usher syndrome. There's a long list, but well, they all have different names. They sort of all share this a few common characteristics that if you have a retinal dystrophy, you probably have a genetic cause for your disease, and you are experiencing degeneration of the retina, like you're slowly losing your sight or rapidly losing your sight, and this usually happens, different areas of the eye. There's lots of different ways that the disease will present itself, but what these diseases share in common is that they have a genetic cause, and that there's something with the retina that is degenerating slowly. So, we could talk more about that later, but this is kind of a big umbrella class of diseases. And that's what the registry was designed to learn more about what are these diseases. Because it's important to know that when the Foundation Fighting Blindness was established, back in 1974, there were people really don't know anything about what genes were involved with these diseases. And it's the more that we learn about, or I'm going to give you a diagnosis and it's retinitis pigmentosa, and then you do the genetic testing, and maybe you learn some more about, maybe you have one gene that's identified, two different genes that are identified. There are many different genes that we now know are involved with these diseases, more than 250 different genes. And so the registry was designed before we knew about a lot of these genes, and before we knew a lot about how these diseases would progress and change over time. So the registry is really, in the most basic terms, it's a database that allows ophthalmologists who are seeing patients that have retinal dystrophies to really keep track of how do these diseases progress over time. And so before there were treatments, before there were gene therapies, this was a very, very valuable tool just to learn about what sometimes gets referred to as the natural history of a disease, what happens to a disease over time. And so over the years, since 2004, here in Canada, we've been kind of growing, spreading the reach of the registry. It started just at Sick Kids. Now we have an enrollment site in Atlantic Canada in Halifax, run by Joanne Robitaille. We have an enrollment site on the west coast of Canada in Vancouver, run by Kevin Gregory Evans, and we have an enrollment site in Edmonton, run by Dr. Ian McDonald. And so we've kind of gradually been expanding the registry. We have plans to add a fifth site for all of our Quebec community, and we have plans to do that in 2018, which we're really excited about and planning for. So what you need to know is that this is a medical database that is based in these hospitals where your care provider, where your ophthalmologist is seeing you. And so what we do at the Foundation Fighting Blindness is, thanks to all of the incredibly generous donors and sponsors, we've been able to provide funds, give money so that the registry can kind of operate, that there's this technological infrastructure that supports the database. And what we can do when you come to us, we can help to connect you to the site that makes sense for you. Because even though, let's say you live in North Bay up in Ontario, well, you're going to be referred to the Sick Kids site. But what if you live in a province where there isn't a registry site? Well, we have a procedure to refer you to the site that has been set up to enroll you. And you don't often need to even travel in person to the enrollment site. You can do a lot of the enrollment over the phone or over email. But the important thing to know is that because it's a secure medical database where your medical information is stored, that is private and it's between you and your doctor. And so we get a lot of questions, a lot of people coming in and asking us, say, hey Mary, can you check if I'm on the registry? No. So I can't check if you're on the registry, and it's set up like that on purpose because we're very, very careful. In Canada, there's lots of legislation to make sure that your health information is private and protected. So I can't check anything about your specific medical history that's in that registry, and it's set up like that. And it's not only can I not check it, other doctors who are overseeing different enrollment sites. So someone in Vancouver can't check somebody's data who's enrolled at the Toronto site. That's really just between you and your doctor. So that's what it's important to know, that it is a secure medical database, and but it's not funded by the healthcare system. It's funded by the Foundation Fighting Blindness because we believe that this is such an incredibly important tool that can connect patients in Canada to clinical trials that they might be eligible and they might be a good fit for. It can connect patients to emerging treatments. And the way that this can work, there's a really tangible example that I've been sharing lately. So, we've talked a lot about, there's like a new gene therapy. It's called Luxturna. In the United States, it's called Luxturna. Really exciting. It works for patients who have been given a diagnosis of Leber congenital amaurosis or perhaps retinitis pigmentosa, but the key part is they've been given a diagnosis of RPE65 biallelic mutations. So what I can do, I can go into the registry and see, we've got about 1,200 patients who are enrolled in the registry. I can go and look up, I can see how many patients have Leber congenital amaurosis. I can get that number. I can look up how many patients have RP, how many patients have this specific genetic diagnosis. And then we can use that information to really try and understand, okay, well, who in Canada might really benefit from this new treatment, and how can we try to work with them to see if, to help us in our fight to make treatments accessible to Canadians. And then another really tangible example of the way this works is that more and more there are clinical trials. This is an experiment that's testing a new treatment. And although, it's unfortunate, many of the trials aren't happening in Canada. That's one of the reasons we were so excited when Dr. Ian McDonald at the Edmonton enrollment site here in Canada, he had Canada's first gene therapy that started a few years ago. But with the exception of Ian, Dr. McDonald's trial, a lot of these clinical trials are actually happening in the United States, and there's a number in the United Kingdom as well. But many of these trials that have United States sites, they go like this because it's like south of the border. They're welcoming Canadian patients. So, we're going to go into the registry, and, if there's a trial for a patient that has a confirmed diagnosis of X-linked retinoschisis, they have a mutation in the RS1 gene, we can go into the registry, and then the registry site where you were enrolled, they're going to contact you and say, hey, you might be a good fit for this trial. Let's let's check it out, let's bring you in, let's see if this is something you're interested in, and take it from there. And I use that as an example because I've talked to lots of different families and people that that are diagnosed, and I meet them at our in-person education events, and there seems to be, it's often not clear when you're signing up for the registry, what are you really signing up for? So this is the other thing I want to make sure everybody knows. When you sign a consent form to join the patient registry at your local hospital enrollment site, you're not signing up to be in a trial, because that's not what the registry is. The registry is a database. When you sign up to be in the trial, when you sign up to be on the patient registry, you're signing up to be in the database, in the secure medical database. You're basically signing up to say, if there ever is a trial, please contact me about it. You're just really consenting to be contacted about a trial that might be relevant to you. And so we're actually doing this process right now. We're trying to contact people who might be eligible for about 4 different trials, and I know there are more on the way. I'm talking to some of these really exciting, innovative, gene therapy companies. This is a growth industry, and this is exciting because, more and more there are going to be trials for so many different patients, and we want to be able to connect you. So I just wanted to clarify those kind of 2 main points, because I would say those are the most common questions that we get that we can't always answer. Because remember, number 1, if you want to check if you're on the registry, we can't check for you. And number 2, you can't, when you sign up for the registry, you're not signing up to be in a trial. It's just you're saying, please let me know if there might be a trial. And the other thing that we get asked a lot, Martina wrote in to ask, what about in Ireland? I'm in Ireland. How would I sign up for a trial? So again, I just wanted to, that's an example. Martina, thanks for tuning in and sending your question. I don't know if you're joining us today, say hi if you're online. So the patient registry is not a clinical trial. It is this database that's kind of classified as a research project. And we always consult with our different PIs. Sometimes we do have international people that get enrolled in the registry, and it's really decided on a case-by-case basis. But I do know that we have great friends who run Fighting Blindness Ireland. So here we are in Canada. We're Foundation Fighting Blindness here in Canada. There's a Foundation Fighting Blindness in the United States. They do incredible work, and they have their own registry. And in the United States, the registry is called My Retina Tracker. And there are so many trials in the United States. And if you live in the United States, get on My Retina Tracker. That's the way to get in line. Put your hand up in the United States. In Canada, the best way for us to communicate with you is to come through the Foundation Fighting Blindness Canada Patient Registry, because I do also get a lot of questions about like the difference between My Retina Tracker and the Foundation Fighting Blindness Canada Patient Registry, and it's just they're completely separate databases, and it's because we all do our best to work together, but because of the way healthcare is administered and privacy laws, and it's just it helps us in Canada if you can enroll on your local Canadian database, and then we can contact you. And then the other, and I'm getting some more questions in. Thanks, Janelle. My colleague here is just sending in some questions. I've got one from Mario, one from Cobus, and I'm going to address those in a moment. Thanks for tuning in. I wanted to first say that I know that Fighting Blindness Ireland, the person there that does a job that's very similar to mine is Laura Brady. Hi Laura, she's fantastic, and they have an excellent initiative called Target 5000. So Martina, you should definitely reach out to them. And then I have another question from Sahad, who is from India. I love that we have such a wonderful international audience. It's really It's amazing actually that I'm sitting here in the freezing cold in Toronto, and we've got this great international audience. Sahad from India. What should I do? He asks. Like, can I enroll? And again, we really decide these on a case-by-case basis, depending on the resources that we have. I actually don't know if there's a similar fighting blindness sort of organization in India, but I do know that there are more than 36 different fighting blindness organizations around the world. We're all part of what's called Retina International. So this is like a coalition where everybody that has a fighting blindness kind of organization, we work together. There's actually, there's a wonderful conference happening in New Zealand, a Retina International conference. I wish I could be there, especially because it is snowing outside. It's going to snow all day. It's very cold. But that's not the only reason I wish I was in New Zealand. It's because it would have been a really great opportunity to meet so many different colleagues and people in this community, because we really are an international community working together. So while we work together internationally, you should try to find your local organization in your own country. And if you don't have one, like, I'm so glad that you can connect with us online, and I hope that we can do more and more of that in the future. Because with many of these new gene therapies, with these new treatments, they work for what are called rare diseases. Hey, that's something else that's in February. February is Rare Disease Day. So the last day of February is International Rare Disease Day. And rare diseases, the definition kind of changes country to country, but I think it's like, if there are less than 5,000, if the incidence is like 1 in 5,000 or less, then it gets considered a rare disease. I'll have to check that. Don't quote me on that. But when you develop a treatment that works for a rare disease, then you want to be able to get that to everybody in the world. You want to know who in the world might this work for. And so this is another reason why we really are very grateful for our international partners. So Mario is asking, could participating in a trial rule you out of taking part in other trials in the future? Mario, that's a really great question, and it's a really important question. And what I will say is that the answer to that question is going to be different for every single trial, but it is an important one to ask. So when you are deciding to go into a trial, you're considering a clinical trial, there's a list of criteria that are called eligibility criteria. It's like, what boxes do you have to tick to make sure that you're allowed to enter the trial? And sometimes you might see a box that says you have not participated in another trial in the past 6 months. I've seen that, for example. So I do know that some trials will say, no, I'm not going to let you in my trial, in our trial, if you were in another trial less than 6 months ago. But some might say, we're looking for patients that are treatment naive. So that's another common word. If you see that a trial is looking for treatment naive patients, it would often mean patients that have never had any treatment before. And that, you know what, if someone's designing a trial and they have the ability to do that, like they have a large enough population size, often it's not uncommon to see that. And that's because when you're designing a clinical trial, it's an experiment, and you're trying to get your end result to be as clean as possible. Meaning, like, when you finish the experiment and you want to ask, did this treatment work or not? Did this work or not? You don't want any kind of conflicting, confusing things that are going to make it difficult for you to understand what you see at the end. So that's sort of the main reason why it is not uncommon for clinical trials to try to recruit patients that have not been in another trial before. So, but it's going to be specific to every single different trial. So it's a great question, Mario. And Kobus asks, are trials restricted to Canada? So again, this is going to be a trial by trial basis. And it never hurts to ask. You know, obviously, running it, maybe not obviously, clinical trials cost a lot of money to run. And often, if a clinical trial is being organized, it would be cost effective to try and recruit people who are local, you know, people that is, you know, easy for them to get to the trial site. But with rare diseases, like they don't affect very many people, it's not uncommon for a trial to welcome people from all over. There was actually a really cool announcement earlier this week, I think, by another one of these excellent new gene therapy companies, Mira, announcing that they've just received a special designation for one of their new very rare trials where they're welcoming anybody from around the world because it's so rare. We can maybe cut and paste, and we'll add the details about that trial in the comments section. So Cobus, what you should definitely do if there's a trial that you think you might be eligible for, you should contact the organizer of that trial and ask if they're accepting people from other countries. So it's always good to ask. And I think I've made it through all of our questions. I have addressed some of the key things that are sort of the main frequently asked questions that come to us about the patient registry. I hope I've been able to give you a little bit of history about why we started the registry back in 2004 and why we're really excited about the work that we really hope it's going to be able to do this year and moving forward. And so we encourage you to learn more, especially if you're in Canada, about how to enroll on the Foundation Fighting Blindness patient registry. And hopefully we'll get our form working again soon. You'll see that disclaimers on the site right now. So please just reach out to us at info. The info account. And one of the reasons why we like to kind of help to connect you is that we want this process to work for you. We want it to be easy and straightforward. And we know that depending on where you live, you might have different challenges. So by connecting with us, you can help us to learn how we can improve how the registry functions and make sure that we're supporting it in the right way. So that's all I have to say about the patient registry. We're going to come back with another Facebook Live session later in February. We have something kind of exciting planned, so we hope to see you again soon. Thank you for tuning in. It's always great. I look forward to these sessions so much. Again, we were going to cancel when we learned about our technical difficulties, and I was like, let's just do it. Let's talk about the registry. And again, I want to finish by thanking all of the donors who have funded the registry since 2004. It's amazing. We absolutely couldn't do it without them. And I want to thank all of the principal investigators who run the registry sites. It is, although we do provide some funding, this is such a commitment for the principal investigators, for Dr. Ayon, for Dr. McDonald, for Dr. Robitaille, for Dr. Gregory Evans. They have put so many hours into this, and it's because they're committed to this future where there are treatments for people, where there is a better standard of care for everybody. And so we absolutely couldn't do it without them. So thank you. And until next time, if you think this is going to be helpful for somebody, like it, share it, and we'll see you again next time.